Welcome back to my channel Knowledge Chronicle.
Today, we're diving into a topic that's rarely discussed openly, but is extremely important: sexually transmitted infections, or STIs. And trust me, by the end of this video, you'll understand why this is something every teenager and young adult must know about. So, what exactly are STIs? STIs, or sexually transmitted infections, also called venereal diseases (VD) or reproductive tract infections (RTIs), are infections that are primarily spread through sexual contact. That means they're transmitted through vaginal, oral, or anal intercourse with an infected person. Some common STIs include gonorrhoea, caused by a bacteria called Neisseria gonorrhoeae. It leads to pain while urinating, discharge from genitals, and sometimes swelling in reproductive organs. Syphilis, a bacterial infection with several stages. Early symptoms include sores or ulcers, but if left untreated, it can damage the brain, nerves, and other organs over time. Genital herpes. This one is caused by the herpes simplex virus HSV. It results in painful blisters or sores around the genital and anal area. Chlamydiasis, caused by Chlamydia trachomatis. It often shows mild or no symptoms at first, but can silently cause damage to the reproductive system. Genital warts, caused by the human papillomavirus, or HPV. Warts appear around the genital or anal area and are highly contagious. Trichomoniasis, caused by a parasite called Trichomonas vaginalis. It may cause itching, discharge, or discomfort during urination or sex. Hepatitis B, a serious liver infection caused by the hepatitis B virus. It's not only sexually transmitted but also spreads through infected blood or shared needles. And of course, the most discussed and feared of all, HIV, which causes AIDS. Let's pause here. HIV, or human immunodeficiency virus, weakens the immune system by attacking vital white blood cells. Over time, it leads to AIDS, acquired immunodeficiency syndrome, a condition where the body can no longer fight infections or diseases. There is no permanent cure for HIV yet, and that's why it's considered one of the most dangerous STIs. Now, here's something even more serious. While most of these infections are sexually transmitted, a few like hepatitis B, HIV, and genital herpes can also be transmitted through sharing contaminated injection needles, improperly sterilized surgical instruments, blood transfusions from infected individuals, from an infected mother to her baby during pregnancy or childbirth. There's some good news too. Except for hepatitis B, genital herpes, and HIV, all other STIs are completely curable if detected early and treated properly. But here's the problem. Most people ignore the early symptoms, which can be very mild, like itching or irritation, fluid discharge, slight pain, mild swelling in the genital area. And to make things worse, many infected females show no symptoms at all. This is what makes early diagnosis so tricky. So if STIs can be treated, why don't people get help? Simple: fear, embarrassment, and social stigma. Most people are scared of what others will think, and as a result, they avoid going to doctors or even talking about it. But this delay can be very dangerous. Untreated STIs can cause pelvic inflammatory disease, also known as PID, infertility, abortions or stillbirths, ectopic pregnancies, or even cancers of the reproductive tract. While anyone can get an STI, studies show that people aged 15 to 24, yes, that's teenagers and young adults, are most vulnerable. Why? Because of curiosity, lack of awareness, peer pressure, and risky sexual behaviors. But don't panic, because STIs are preventable. Here are 3 simple ways to keep yourself protected. First, avoid sex with unknown or multiple partners. The more the partners, the higher the risk. Second, always use condoms during sexual intercourse. Condoms significantly reduce the chances of transmission. Third, if you suspect anything, consult a qualified doctor immediately. Early diagnosis and complete treatment can prevent major complications. Remember, being aware and responsible doesn't make you weak. It makes you smart and safe. Friends, STIs are not just a medical problem, they're a social challenge. It's high time we break the silence and talk openly about them. Awareness can save lives. So, if you learned something valuable today, don't keep it to yourself. Share this video with your friends, classmates, or family members. And as always, your one like, share, and subscribe will help us create more valuable content. Thanks for watching Knowledge Chronicle. Stay curious, stay informed, and most importantly, stay safe.